So I welcome you all to the session. Myself Rajita, and in today's session we are going to discuss, or you can say we are going to continue the discussion of concept of health and disease. So I guess in the last session you have learned and you have understood what do you mean by health. We have seen the concept of health. So basically we have seen the concept of health by in four perspective. So some first one being the biomedical concept, the second one being the psychosocial or mental concept, the third one being the ecological concept, and the fourth one being the spiritual concept. So through which we understood what do you mean by health. So then there we have seen basically health is considered when an individual is not present with any kind of diseases. They are maintaining a normal level of functioning, or we can say a optimal level of functioning. Their every cells of the body is working or functioning with maximum functionality and maintaining a harmonious condition with the other cells too, as well as when the person is with equilibrium state with the external environment and internal environment, we are calling the person is maintaining the state of health. Now, we understood, or also we have learned regarding the philosophy of health, the determinants of health, which basically considered as the factors which influence the health in order to promote it or cause a deterioration. Now, as we have learned about the concept of health in the last session, here in today's session, we are going to discuss about the concept of disease. So first we are going to learn about the definition of disease. So according to Webster Dictionary, disease is defined as a condition in which the body health is impaired. It is a departure from the state of health, and also it is an alteration into the human body which is interrupting the performance of vital functions. Basically, what it means to say is in this condition, an individual will not be able to continue its physiological activity, and also there will be alteration into their physical beings. We are going to see they will, or their health status, that is the well-being of physical, mental, social, environmental state will be impaired. Due to that, they won't be able to a position where they will be able to perform the vital functions that they're supposed to. The Oxford Dictionary defines the condition of disease as, so it is a condition of the body or some part of organs of the body in which its functions are disturbed. Basically here what we are seeing that according to this definition, it is suggesting that either the whole body will be having a functional disability, or maybe some part of a particular organ of the body will be having functional inability to perform their vital organs. And when it is occurring, when body is failing to perform their vital organs or vital activity, definitely we are going to see the client will be not be able to maintain the harmonious synchronization of the physiological phenomena which is continuously occurring within the body. For example, now as we know, in order to survive and in order to provide necessary oxygen, nutrients, the blood has to be circulated each one of the cell of our body. Even from the hands to the lower extremities till the toes, in the whole brain, and each one of the cells should get adequate amount of blood in order to survive. Now suppose an individual person who is present with a normal physiological condition somehow exposed to certain factors. Now these factors cause a deterioration of health, where their heart or the major important organ of the cardiovascular system is failed to perform its activity. Now, if the heart is not able to manage or not able to produce adequate amount of blood from its compartment, definitely there will be disruption of the blood circulation. Now, if there is inadequate blood supply to the organs or to the vital organs or in the different cells of the body, what will happen? Definitely we are going to see slowly and steadily a person will be developed with certain systematic disease condition, where due to lack of the blood supply, the vital organs or the other vital organs like the kidneys, gastrointestinal tract, maybe the lungs will be failing to work properly. Even our brain cells will be not be able to withstand with the inadequate blood supply, where they will be lacking the oxygen and nutrients. That's the reason why cells will be lacking the necessary elements to function, and they will be stopped functioning, and that's how a person may develop with a life-threatening scenario. So I hope that's how you have learned or you have got the idea or concept of disease, how it is or how it can affect. And also we have learned that if there is any functional alteration of the whole body or maybe a particular part of a organ within the body, may leads to the development of life-threatening diseases. Now, definitely depending on the stages, depending on the type, the person may show mild to severe signs and symptoms. So if we talk about the concept of disease, as we have said earlier, the ecological concept suggests or define the disease as a maladjustment of the human being to the environment. Here, basically, the ecological concept suggests when our client is not able to adopt the changes and adjust with the environmental changes, it means that they have certain abnormality or certain maladjustment within the body, which is known as the disease. So now if we talk about the simplest definition which refers what disease is, so the simplest definition suggests the disease is just opposite state of health. So as we have learned, health means the person is maintaining the optimal level of psychological, physical, social and environmental functioning. But here in disease, as it is the opposite, here the functioning or vital functioning of an individual is getting interrupted or disrupted. Any deviation from the normal functioning or from the state of complete physical, social, psychological well-being is considered as disease. Now we are going to learn about the distinction between disease, illness and sickness. Now generally these three terminologies of disease, illness and sickness are almost always used simultaneously. But these three particular terms, they do carry different meaning. So here we will be learning about the distinction between the terminologies of disease, illness and sickness. The disease or the term disease, it literally means without ease. So it means that there is presence of some kind of uneasiness when something is wrong or deviated from the normal bodily function. So as we have learned that disease is at that state where the person is not maintaining the well-being or physical and psychological or social well-being, right? So definitely they will be complaining regarding some kind of uneasiness, and this is the state which is known or termed as a disease. Now, illness. The term illness basically refers to the presence of a specific disease, and it also refers to the individual's perception and behavior in the response to the disease, and it also focuses on the impact of the particular disease on psycho-social development and environment. So I hope you understood that disease is the presence of uneasiness or the deviation of physical, social, and psychological well-being. Whereas illness is basically focusing on the individual's perception and behavior towards the disease process or towards the deviation that have been occurred. So I hope through this particular statement you got the idea about the differences which is present between the term disease and illness. Now, whereas the third term, that is the sickness, basically refers to a state of social dysfunction. Sickness is when a person is not able to manage with their society. They are not able to socially able to function optimally. That is when in social dysfunction, when it is occurring due to the disease process, we are terming this condition as sickness. So I guess now you understood the difference between the disease, illness, and sickness. So disease literally means the presence of uneasiness or a deviation from physical or social or psychological well-being, whereas illness is basically focusing on the individual's perception of behavior of the deviation, whereas sickness basically refers to the social dysfunction that is related to the deviation of the health. So basically, disease is a physiological or psychological dysfunction. So as we have learned here, due to certain etiology or due to certain causes or reasons, the person is not able to perform adequately in a physiological term as well as in a psychological term. There are certain deviation from the normal functioning level. Whereas the illness is basically a subjective state of a person who feels aware of not being well. So basically it is a feeling of an individual. Now, as we are going to say that many severe disease, if a person is present with a very severe disease, maybe their concept will be or their behavior towards the disease will be different compared to others. So that's how the illness basically varies from person to person. But disease are definitely a deviation in a physiological or in a psychological state. Whereas sickness basically refers to the state of social dysfunction. Now, disease, for example, a role that individuals will be assuming when they are feeling ill, which is known as the sickness role. So when the person is assuming or understanding that they are not well and their behavior is changing according to it, and it is considered to development of a social dysfunction, then we are terming this condition as the sickness. So I hope till here you are completely understood the difference between the sickness, illness, and disease. So basically, this three particular term is connected with the disease process. Once the disease process is occurring or the pathological process is occurring, it will be definitely leading to the development of disease or a complete deviation. Now, because of this deviation, a person will be assuming their health or illness and will be, behave in a particular manner, so that is considered as an illness, and they will be also assuming their role after being ill, that is considered as sickness. So generally, when disease is tend to occur, the disease can occur when there is an interaction. Now, as we have learned that there can be three factors: the agent, host, and environment. Now, we are going to read about the classification of factor triad related to the disease process. So first, we are going to read about the host factor. Host basically suggests the individual who have developed with the deviation from the health. This host also have certain internal factor which influence them to get the disease process or development or progression. Now, this host factors includes the age, sex, race, religion, behavior, practices, as well as their beliefs and lifestyle. These all factors are basically related with host. Why? Because the age, gender, or the sex, religion, their practices, behaviors, lifestyle, everything differs from one particular host to another. Now, if we want an example, I can say that suppose a particular individual has been developed with a particular disease. For say, an individual have developed with a cardiovascular disease. The name of it is coronary artery disease. Anyway, when we are discussing about the cardiovascular disease process, you will be reading this condition in the depth. But here, just for the example, I am telling that if a client or if an individual have developed with coronary artery disease, now suppose this particular patient have a past history of hypertension and also he have a habit of smoking. Now here, the coronary artery disease is developing maybe because of the habit of smoking and the hypertension. This too is the factor which is directly associated with the development of this disease condition. Now, this particular habit of smoking is the host factor which is leading to the development of coronary artery disease for this particular patient. Now, whereas the second patient or the patient B, we can say, may have diabetes. Now, he also have been recognized or diagnosed with the coronary artery disease. Now, this particular patient is developed with the diabetes or with the coronary artery disease because of the underlying pathological process of diabetes. Even the patient B, suppose, have an increased age. Now, increased age also considered as one of the most important host factor in case of patient B while diagnosing the condition of coronary artery disease. That is how two different patients have different host factor which may have influenced or may be associated with the development of the coronary artery disease. So I hope till here you understood the concept that why we are considering or why we are reading about the host factors. Because the host factors may be differ from one particular patient from another, but this host factor may be associated with the development of disease. I'll give you one more example through which you will be having a complete clear idea about what is the host factor is and why we are considering the host factor when talking about the disease. Now, when we are going to read about the male reproductive system, we are going to see that there will be development of prostatitis or prostate cancer often in male individual. Prostate is nothing but a particular gland which is associated with male reproductive tract. Now, we are going to see associated with the increased age of an individual male, the person will be more prone or more likely to suffer from prostate cancer or prostatitis. Now, this particular disease have a relation with the host factor, which is basically age. Because with the increased age only, the prostate cancer or the prostatitis kind of disease will be more prevalent. That's the reason we should definitely consider the host factor also. Now, definitely, host factor is not only one particular determinant will be causing the disease, it will be having the interaction between the triad, that is the host factor, the environmental factor, as well as the agent. So as we have learned about the host factor, what can be the host factors, next we are going to learn about the environmental factors. Environmental factors can be physical factors like suppose exposure to light or radiation, certain exposure to certain chemicals, as well as the air, etc., can be considered as a physical factors. There can be certain social factors like the lifestyle, cultures, values, behaviors, understanding of health. Everything comes under the social factor. Climatic factors. Now, as we know, throughout the world, there are different regions which obviously have different climatic features. So depending on the climatic features also, some diseases may be prevalent in some particular climatic region, whereas the other climatic region, those diseases will not be very prevalent. The next environmental factor is socio-economical factor. As we have learned, as an economical or socio-economical factor, the education, occupation, and the income also influence the health and disease development. So definitely here also we are going to see this economical factors influence the health and helps in the development of disease process. So for example, majority of the client, if they are below the poverty line, many of the disease process is more prevalent among this group of population. Now, it can be due to the inadequate knowledge regarding health and illness. This can be due to inadequate knowledge regarding the hygienic practice, regarding the available medications and resources to improve their health and well-being. Now, economic factor also is basically causing the progression of the disease. Now, the next environmental factor is biological factor, which is specifically an internal factor, which is specifically, assessed by the genetic makeup or genetic constitution and chromosomal constitution of an individual being. So ultimately, these are all the environmental factor, that is internal and external environmental factor, which is basically causing the development of a disease process for an individual. Now, as before we have read about the host factor, now we have studied about the environmental factor. Now, next we are going to learn about the agents, which also have a vital role in the disease process development and progression. So let us discuss now about the agents. Now, there can be various agents which are living or non-living, can invade to individuals' body and can cause alteration of the functions. Now, if we talk about the agent which are also interacting with the environmental factors and host factors and causing the development or progression of the disease, this agent can be divided into few more classification. The first classification of the agent is the biological agent, which the example of it includes the bacteria, fungi, viruses, protozoas, which are present in the environment. Now, we all know these are the microorganisms that are present in the external environment of the body, and this particular conditions or this particular biological agent actually can alter the physiological functioning of an individual. So this all organisms or microorganisms like bacteria, viruses, protozoas can invade to an individual's body and cause the disease process to occur. So for example, a human immunodeficiency virus can lead to the development of acute immunodeficiency syndrome. Here what is happening? The HIV or human immunodeficiency virus is a biological agent which is invading to individual's body and causing the development of acute immunodeficiency syndrome disease. Next agent we generally consider that nutritional factors or nutritional agent factors. Now, as we have seen that these are the factors or agent which also can increase the chances of the development of disease. Now, for example, iron deficiency or folic acid deficiency sometimes can cause the development of disease. Certain deficiency of vitamins also can cause the development of some specific type of disease. As we have studied the iron deficiency can lead to the development of anemia. In cardiovascular system in medical surgical nursing, we are going to discuss in detail about how the iron deficiency is causing the anemia development in the patient. So basically what I mean to say is this particular factors, or what we also call it as the nutritional agent and deficiency of it, can actually alternating the physiological functioning ability of an individual and is causing the development of the disease. Next is the physical agent. So here the heat or exposure to heat, different altitudes, sounds or exposure to sounds, and humidity sometimes may leads to increase the chances of the development of the deviation from the health and well-being. Here also this physical factors is actually causing the changes which is unwanted and causing the developmental or defect, or we can say causing the development of diseases among the individual. That's how the physical factors or the physical agent is also causing the disease. The next factors are chemical agent. Now it can be endogenous or exogenous. Endogenous does mean the chemicals that are present within the body. Exogenous means from the external sources. If we are exposing to certain chemicals, can alter our genetic constitution or chromosomal constitution even, and can cause the deterioration of the health and leads to the development of disease. The next one is hereditary. So heredity is also an agent which can cause the disease or which can increase the chances of the development of disease. So as I have mentioned, once a particular individual is present with a family history for a particular disease, it actually can increase the chances of the development of that particular disease for the next offspring. So almost always we see if a person is present with obesity or hypertension, or if they have a positive family history for this type of disease condition, they are more prone to develop with this hypertension or diabetes later on in their life. There's a reason. As they cannot manage or they cannot control the hereditary factors, they should definitely focus on the environmental factors to minimize the chances of the development of the disease progression. So I hope you understood the concept that how the disease progression or how the development of disease is occurring. So remember always the host factor, environmental factor, and the agents are interacting among within themselves and causing the development of disease. Now, if you want to minimize the chances of the disease progression, we can actually will be focusing on those factors which can be changed. Now, definitely, as we have studied that with increased age, a person will be more likely, basically a male individual is more likely to develop with prostate cancer. The environmental factors being the lifestyle. So if it has been seen that if a client is having the habit of smoking or alcohol consumption, they're having higher risk for the development of prostate cancer. The third, if we see the agent, we will be seeing the exposure to certain things like certain radiations, chemicals, also will be increases the chances of the development of prostate cancer. Now, there can be even the hereditary factor. Now, suppose a person is already reached with the 55 years age. This particular factors is not modifiable. So we can say this is a non-modifiable risk factor. So we definitely cannot modify. So we are not going to focus on that particular matter. The second factor is the environmental factor, that is the habit of smoking and alcohol. Now this is a factor which is modifiable. So we need to focus or we need to force the client to modify their lifestyle and habit so that there can be a minimization of the chances of disease development or progression. Even the hereditary factor as an agent, we cannot control it or we cannot minimize it. So that's the reason we will be focusing on the modifiable factors within the environment and agent which can be minimized and maintained, and which also helps an individual to reduce their chances of the development with a particular disease condition. So I hope till here you understood that how the host factor, environmental factor, and agent factor are combining together and causing a disease progression. I hope you also understood how, as a medical professionals, we can teach the general population regarding minimization of the modifiable factors, which ultimately will be reducing the chances of the development of disease and improving the health and well-being for a particular individual. Now, if we talk about the process of the disease, you see definitely, as we have studied, the factors or the host factors and the agent will be interacting, and even it will be having an interaction with the environmental factors. Interaction of these three factors is basically going to affect the individual person. Now, the disease process will be occurring and it will be progressed if the client is not present with adequate immunity. So I hope you had it clear. If an individual is having enough immunity, the effect of this three factor and the interaction of this three factor will be neutralized and the person will be achieving the state of equilibrium. This particular factor of immunity within the host plays a very important role in the disease process and its definition. Wherever a disease is occurring, if the person's immunity is adequate enough, that person can cope up with the disease process and its effect. That's the reason here, as a medical professional, we also have to focus on building the immunity from the childhood for every individual being in order to help them to manage with the chances of the development of disease. Now, suppose if the individual is not having the adequate amount of immunity, we are going to see firstly, they will be developing with the sign and symptoms, because definitely the interaction of host, agent and environmental factors will be causing certain alteration into the body, which will be causing the sign and symptoms development. Next, the client will be present in a state of illness where they will be having the feelings or a particular way of behavior towards their alteration of the physiological factor or physiological phenomena. The next phase comes is diagnosis. So definitely with the sign and symptoms, our client is more likely to approach to the clinical setup for the diagnosis to be done, and next it will be followed by a treatment procedure. Now, either the person will be responsive towards the treatment procedure, so they will recover and will be managed or will be able to manage the equilibrium. But if they're not responsive towards the medical treatment, they may develop a chronic illness, or even the client can leads to the development of disability, even they can go for death. So I hope you are understanding how the disease cycle is causing the development of the life-threatening scenario and how the client is able to recover from the disease process. Now, for example, if you were able to understand this in a more better way, that's the reason I am providing this example. So as we have studied about the disease cycle, now suppose a particular factor like an agent has been introduced. Suppose a virus has been invaded to an individual's body, right? Now, as we have studied, this is the agent which has invaded. Now, there are host factor. Suppose a person is present with increased age, right? Or they are not maintaining adequate hygiene, right? So their immunity will be less generally. So here, the invaded virus is more likely to develop the infectious process. Now, environmental factor. Suppose the person is not maintaining a good dietary habits, or they have a heredity or genetic constitution where they are lacking the immunity system, which will be invading the pathological organisms. So this all factors basically are influencing or helping the invaded pathogens or particular virus to develop a particular disease condition. So in this phase, the person is not present with adequate immunity, and interaction of environmental agent and host factor is causing the development of disease. Now, that if the virus has been caused some infection, the person is more likely to present with the signs and symptoms like fever, maybe inflammation, certain fatigue and tiredness. Here, definitely the client will be feeling the feeling of illness. So they are in this stage of illness where they will be approaching to the medical treatment or clinical setup in order to get diagnosed. Now, diagnosis will be done by providing certain blood tests or performing certain diagnostic procedures. Where suppose a person is diagnosed with the certain infection. Now, treatment would be provided by an antiviral therapy or maybe antibacterial therapy, where if the client is responsive towards the medical treatment, they will be completely recovering from the disease progression or infectious disease. But if the management or the treatment is not adequate enough, or the client is not showing any responsiveness towards the treatment, we are going to see it will be causing a chronic illness development where the client will not be able to cope up with their disease process and will not be able to reach to the optimal functioning and equilibrium state, where the client definitely will be leading to develop a life-threatening scenario. That's how the disease process basically either progressed or either a client will be able to recover from the disease process. Now, in case of mild diseases, our body immunity will be adequate enough to provide the protection. Causing the changes within the physiology, definitely we need to introduce certain medical treatment to provide protection against the disease progression. So I hope you completely understood the condition where the disease is developed and how it is progressed. So with this understanding, I hope you understood that the prevention of the disease is better than curing it. So cure of the disease, or when you are performing the curative aspect of the disease progression, it definitely is not cost effective enough. The client may or may not recover from the disease progression. Even some disease can lead to the development of chronic health issues or certain complication development. That is the reason prevention of the disease is the main focus nowadays in the healthcare setup. So there are basically the 4 level of prevention are present. So when we talk about the disease process and the concept of disease, definitely as a medical professional, we should learn regarding this 4 level of prevention of disease. Now we are going to discuss one by one about the each level of disease. So the first one is the primordial prevention. It is basically prevention of the development of the risk factors. Now, when a person is about to get or about to habituated with the smoking or with alcohol consumption, that particular factors or habits are considered to be risk factor for many of the other disease progression, right? So that is when, if we are managing or if you are preventing the development of those risk factor itself, that will be reducing the chances of the development of further disease progression and development. That is considered as primordial prevention. It is basically focusing on the maintaining a healthier lifestyle by an individual. So suppose, for example, that if an individual is not maintaining a proper dietary intake and they're not maintaining a proper hygienic practice and they did not perform any physical exercise daily basis. So this all factors are basically the risk factor for the development of many diseases and progression of the diseases, right? So here, before the person is developing this altered level of their daily activity, this should be prevented. So here, the person will be taught regarding their lifestyle and what they're expected to do. So that's how the primordial prevention will be preventing the development of the risk factor. Now, the second level of prevention is the primary prevention. Now, the primary prevention is basically the health promotion and specific prevention. Now, as I have mentioned, if a client is already present with a positive family history, after a certain age, they would be suggested to go for a regular health checkup at a regular interval to find out if there is any alteration at the earliest. Even they can perform the health promotive activity depending on their family history or depending on their likelihood to develop a disease condition. Now, for example, if a client is having a family history of hypertension, after a certain age, they would be suggested to go under a regular checkup for the blood pressure at a regular interval so that the alteration can be recognized at earliest. Even the client will be suggested to maintain or to perform some health promotive activity which includes the stress management, eating a balanced diet, reducing the intake of direct salt or sodium, and also maintaining a proper bowel and bladder habit and intaking of adequate level of water, or basically maintenance of the hydration. This all health promotive activity basically is preventing the chances of the development of the hypertension for that particular individual. That's the reason, as it is basically trying to prevent the specific disease condition for a particular individual. That is why it is known as the primary prevention. Next level of prevention is known as the secondary prevention. Secondary prevention, the elements of it includes the early diagnosis, the prompt treatment and prevention of complication. So as I've mentioned, if a client is already developed with a particular disease condition, definitely early diagnosis and prompt treatment plays here a very important role. So for example, if a client is present with hypertension, so already she or he might have developed with hypertension. Now, the focus should be diagnosing the condition of hypertension. So we will be understanding in which state he or she is in. We will be treating the client as early as possible with antihypertensive medication, with the antihypertensive diet therapy, as well as we will be suggesting the client to go for certain lifestyle modification surely to minimize the chances of the development of complication of the hypertension. So always the patient with hypertension have increased chances of the development of coronary artery disease or any other cardiovascular disease. Here, by performing the secondary preventive measures, we are basically trying to prevent the development of the complication like the cardiovascular disease in secondary to the hypertension. So I hope you understood the concept of the primordial prevention, where we are preventing the development of the risk factor. The second is the primary prevention, where we are basically focusing on the health promotive and specific preventive activity. The third, that is the secondary prevention, where the client is already developed with the disease condition. We are trying to administer the early diagnosis and prompt treatment, as well as we are trying to prevent the complication development. The fourth type of prevention is known as the tertiary prevention. Here, our focus will be to minimizing the disability, and also we will be providing the rehabilitation care. So basically, through the tertiary prevention, we will be trying to maintain the quality of life, even though the client is suffering from a chronic or acute illness. We will be trying to minimize the development of disability, and we will also provide the rehabilitative care. Now, for example, if a client is present with diabetes, we know as a complication of diabetes, the person may develop with diabetic foot, which will be definitely causing a disability of the client. Now, here, our role as a medical professional in the tertiary preventive stage is to minimize the chances of the development of diabetic neuropathy or maybe the diabetic foot development. That's how we are basically going to follow this 4-stage of prevention. The first one is primordial prevention, where we are preventing the chances of the development of risk factor. Primary prevention, where we are performing the health promotive activity and specific health protection activities. The secondary prevention, where we are basically focusing on the early diagnosis and treatment and prevention of the complication development. In tertiary prevention, where we are basically reducing the chances of the development of disability, and we are providing the rehabilitative care to the patient in order to maintain the quality of life. So now we are going to read one by one what are the components of each stage of prevention. So first, we are going to read about the components of primordial prevention. It includes changes of the lifestyle, majority of the case. So changes in the food habits, exercise pattern, the habit of smoking and alcohol consumption, and performing naturopathy or yoga and daily activity is the main and basic concept of primordial prevention. Whereas in the second step, that is the primary prevention, basically includes the health promotion and specific prevention. So the component of health promotion includes providing health education to the general population, nutritional interventions, lifestyle and behavioral changes, and regular exercise and following a proper, healthier lifestyle. Whereas the specific protection, the components of specific protection of the primary prevention include following immunization schedule, chemoprophylaxis, nutritional supplementation, creating a pollution-free environment where even the carcinogens and exposure to carcinogens are minimized, noise control, standardization of consumer product control accident. This all are the factors or components of the specific protection which comes under the primary preventive level. Next, we are going to read about the secondary prevention, which mainly focus on the early diagnosis and prompt treatment. So the component includes a regular health checkup, community health checkup, checkup of pregnant mothers, children's, and the older adults. Checkup or regular health checkup for the high risk group, people who have the habit of smoking, continuous or who have a chronic alcoholism, patient with obesity, sedentary worker or factory workers, which basically increase the probability of the development of specific disease. Health checkup or regular health checkup or of those and early treatment initiation is the major component at this stage. Next, we are going to read about the components of tertiary prevention, which basically focus on preventing the disability development. The disability limitations will be done through a proper exercise, maybe a physiotherapy would be requested or suggested to the client, occupation therapy, corrective and plastic surgery, even improve the mobility of the client is the major component in this stage or in this level of prevention. Rehabilitation care basically focus to change the mental and physical ability so that they can lead a more productive life in spite of presence of any diseases. Definitely the occupational therapies is nowadays came into the practice, which definitely helps the individual to maintain their health while performing a high risk job. Now, there are certain different aspects of prevention also present in today's practice, which includes the universal prevention. The universal prevention generally addresses the entire population and aims to reduce a high risk factor which are more prevalent in the general population worldwide. For example, tobacco consumption, abuse of alcohol and drugs are nowadays more prevalent in the general population. Universal prevention or universal preventive approach is basically focused to minimize all these habits and development of the habits within the general population. All individuals are supposed to get through a screening test, and also they will be providing with the information and necessary skill so that they can fight against the development of the abuse of drug and alcohol consumption and the habit of smoking development. That's how the universal prevention will be basically addresses the entire population to minimize the chances of any risk factor development. The next we are going to learn about the selective prevention. Now, generally, we are going to see the selective prevention will be focused on the high risk group. So generally we will be able to see where the illiteracy rate is very high. They are not very much aware about their practices, hygienic practices or lifestyle. There we are going to focus on that particular group who are present in a lower socioeconomic economic group of in the society. We will be trying to provide adequate information and education regarding lifestyle modification. Now, this is the selective prevention where we are focusing on the lower socioeconomic group to understand their lifestyle and to provide them necessary skill and information to fight against the poverty and illiteracy and the disease condition which is more prevalent and on those specific groups. There are also one more concept that is considered as the indicated prevention. Now here the indicated prevention will be administered to those who are already present with the minimal sign and symptoms for a particular disease condition or alteration. Here the indicative prevention will be basically helping the individual to minimize the chances of the disease progression for them. So I hope till here you have completely understood the whole concept of the disease and disease prevention. So initially we have learned about the definition of the disease, we have learned about the concept of the disease. Also, we have learned about the different factors which are basically considered the most important factors because of what interaction will be causing the disease process development and progression. We have seen there are factor triad which includes the host factor, environmental factor as well as the agent factor. Interaction of it always will be causing certain alteration. Now we have also seen definitely it depends on the client's immunity that whether the interaction of these factors will be able to bring certain alteration into their physiology or not. Now, depending on that, we understood immunity here plays a very important role to prevention of the disease. And depending on that particular theory, we have suggested or we have read 4 level of prevention what definitely as a medical professional we should learn so that we can able to provide adequate care in different level of prevention so that the disease progression can be minimized and there can be prevention of the complication development for a particular individual who are already diagnosed with a particular disease. So we have seen 4 level of prevention which include the primordial prevention, primary, secondary and tertiary prevention. We have also seen what are the basic role in this preventive level and each one of the level what are the basic component of each level of prevention. I hope till here you are completely understood how the disease progression can occur, how the disease can be developed and how it can cause the alteration. Also we have learned as a medical professional our role in the preventing the disease process to occur. Thank you so much for attending the session. I hope you guys have enjoyed the session. Stay tuned for the next session where we will be discussing regarding the concept of illness. Thank you so much. See you guys in the next session.